Okay, so now we're working the right knee. Right in here, you said you're feeling discomfort a little bit.
Inside. Yeah.
Inside, right in here?
Yeah.
Okay, and you said it's mostly when you're getting up out of a chair?
Yeah, and walking also.
And walking, okay. So, potential is she's got a little bit of scar tissue in here, maybe some inflammation. What we want to do is just make these tissues a little more elastic, a little more pliable. So my version of active release therapy that I've modified since becoming certified. It's been a long time since I've actually recertified, but I don't really need to. My technique is very strong. Okay, so what you're gonna do is you're gonna straighten your knee to here, and you're gonna bring it down and make your calf touch the table, okay? And bring that leg down slow. Okay, so hold that there.
Mm-hmm.
Okay, down, slowly. I'm gonna start from the outside and I will go to the inside. Make your calf touch the table. And back. And go. How was that pressure?
Yeah, good.
Is it kind of a hurt, good feeling? Ooh, not that one. Back. Okay, I'll go a little lighter. Keep going, keep going, keep going. How's that? A little better?
Yeah.
Back. Go. So even though her knee hurts primarily on the inside, you can tell she's got some tenderness, hypersensitivity on the lateral side. Go. Or outside. So we want to kind of, that hypersensitivity, it could be, just trapped pockets of inflammatory fluids. So by doing this, we can disperse those fluids and push them out of those little trapped pockets. Those fluids cause nerve endings to become a little more hypersensitive. And so we want to kind of reset them. Go. Give them that input, that pressure, and that shear and stretch that's happening with my finger. Okay, straighten that knee. Straighten it. Go. Back. Go. How are we doing there?
Yeah, that's good.
Back. Go. Back. A little slower, don't go too fast. Back. Go. So I was doing about 20% and I'm dropped down to around 15% pressure. Back. Go. So again, just
it's tender.
okay. Go. So again, what we're doing here is trying to reset the neurology. Go. The mechanoreceptors in this area have become very hypersensitive.
Yeah.
Go. So by giving the input they're looking for, again, pressure, vibration, and stretch, they start to reset. And over time, I can start applying more pressure and she'll feel less discomfort, and that's because we're restoring those mechanoreceptors back to a more normal state of health or function. Doing okay? Go. Back. Go. Back. Go. Come down a little further here. How's this in here?
Yeah, it's good.
Hurts good? Go.
Yeah, that's tender.
Go. How's that feel? It's okay. Does it feel good? Is it?
Yeah, it's soft.
Yeah, good. Okay, so now vibration, again, stimulating mechanoreceptors that detect vibratory input. And so I'm just going very careful with a very light pressure on all of these hypersensitive tissues. And we want to reset those mechanoreceptors. Make it so they're not hypersensitive with vibratory input. We want vibratory input to be something that they can tolerate without discomfort. So by applying the input very carefully, over time, the hypersensitivity goes away. Doing okay still?
Yeah.
Now she may be a little sore from the work that I'm doing, but I'm going light enough that it won't be a terrible soreness. It'll be a light soreness.